What is the connection between alopecia and adverse childhood experiences or ACEs? Once upon a time, in a far off land, there lived a majestic forest called Tricholwood, where the trees bore lush, vibrant leaves that danced in the gentle breeze. Each tree represented a person, and the leaves symbolized the experiences they had in their childhood. One day, a group of trees started to lose their leaves mysteriously. At first, it was just a few patches here and there, but soon enough, these trees were completely bare, or should we say bald. They were shunned by the other trees who whispered amongst themselves about their strange condition. And these trees, well, they were known as the alopecia trees. As time passed, it was revealed that the alopecia trees had all faced severe storms during their early years, which had damaged their roots and affected their ability to hold on to their leaves. These storms represented the adverse childhood experiences or ACEs that they had endured: trauma, neglect, abuse, and other hardships that had left lasting scars. The alopecia trees struggled to grow new leaves but could not, no matter how hard they tried. They felt isolated, ashamed, and different from other trees in Tricholwood. Despite their efforts to fit in, their barren branches served as a constant reminder of their past struggles. In my narrative, the alopecia trees serve as an allegory of those people who are affected with alopecia as related to ACEs. Some may ask, what is alopecia? And in the simplest definition I can share, alopecia is a medical term for hair loss or baldness. And adverse childhood experiences or ACEs are traumatic or stressful events that occur during childhood, such as abuse, neglect, household dysfunction, or exposure to violence, which can have lasting negative impacts on a person's physical, mental, and emotional well being. Through my over 30 years in the hair industry and as a practicing trichologist, I have had the privilege of assisting hundreds of women on their journeys with alopecia. I not only provide them with amazing and natural looking cranial prostheses, but I also lend a listening ear as they share their deeply personal stories of hair loss. And sometimes the role I play goes beyond just hair. It's about offering comfort, empathy, and a safe place to be vulnerable. And I've handed out countless Kleenex, knowing that sometimes shedding tears is just as important as shedding old hair. And it's an honor to be a part of their transformation, not just physically, but emotionally as well. ACEs were originally described by doctors Robert Enda and Vincent Felitti in the ACE study, initiated by the Centers for Disease Control and Prevention and Kaiser Permanente in 1995. In a report by Choice MD, it shared that recent studies indicate that almost 60% of children growing up in the United States experience at least one adverse childhood experience before reaching the age of majority. And one way that social workers, doctors, therapists, and other medical providers can track that risk is the ACE score. The ACE score is based on adverse childhood experience test. It's a simple 10 question quiz. Adverse childhood experiences causes stress, which affects the body in a lot of different ways. In my hair restoration center, I have noticed how trauma can cause alopecia in several ways, and here are a few, many of which I am familiar with serving hundreds of clients. Now, this client is a perfect example of physical trauma. She was a burn victim, and as I gently assessed her scalp, I observed the evidence of scar tissue and hair loss, which was a heartbreaking reminder of the trauma she endured 30 years ago. And my heart ached, recognizing the emotional and physical toll the burn had taken on her scalp and her self esteem. Can you imagine the countless young women that I have listened to in my career share their struggles with traction alopecia, which is mostly caused over time by years of wearing hair extensions, sewn in weaves, braids, or ponytails much too tightly? 90% of those clients express their sadness and frustration at permanently losing their hairlines as a result of trying to live up to society's impossible standards of beauty. Telogen effluvium primarily presents itself after experiencing significant stress. And I have personally witnessed clients suffering from emotional trauma, such as abuse, the loss of a loved one, severe illness, or major surgery, and experience this diffuse shedding of hair. Most commonly, I see this type of alopecia following surgeries like gastric bypass. Have you ever noticed anyone with small circular patches on their scalp or other areas of the body? Well, alopecia areata is an autoimmune condition that can be triggered by severe stress and trauma. And one of my youngest clients endured bullying at school because of her alopecia areata. I will never forget her look of devastation as I showed my client the microscopic view of her scalp. It was central centrifugal cicatricial alopecia, or CCCA. It is a scarring type of alopecia, and this type of hair loss destroys hair follicles and leads to permanent hair loss in the scarred areas. And for the majority of people, makes them feel the loss of hope in the full restoration of their hair. The relationship between trauma and hair loss is complex, and it can involve a mix of physical and psychological factors. Chronic stress from ACEs can lead to a prolonged activation of the body's stress response system, which disrupts the normal cycle of hair growth, causing hair to thin and to fall out eventually. And stress can also affect the immune system, potentially triggering autoimmune responses such as alopecia areata, where the immune system attacks hair follicles. The stress from ACEs can lead to hormonal imbalances that may contribute to hair loss. For example, stress can affect the adrenal glands, thyroid, and other hormone producing glands, which can indirectly influence hair growth and health. And one such hormonal imbalance that I see regularly in my treatment center is polycystic ovarian syndrome, or PCOS. Also, there are those with a history of ACEs that adopt unhealthy coping mechanisms like poor nutrition, substance abuse, or even self harm, which can further contribute to hair loss, either directly or indirectly through physical damage or nutritional deficiencies. Trichotillomania, also known as hair pulling, is an example of a stress related behavior that can also lead to hair loss. And over the years in my practice, has provided the care to many clients with trichotillomania. And part of our intake and protocol is to inquire as to whether they are seeking some sort of counseling or therapy due to this characteristic being compulsive. And there are types of alopecia that are primarily immune conditions. Emma J. Molden's study on adverse childhood experiences and their connection to autoimmune diseases in adulthood in part stated, recent studies have begun to show that stress may play a considerable component in developing an autoimmune disease. And retrospective studies have found that up to 80% of patients reported uncommon emotional stress right before disease onset. And this study has proven that a majority of patients with autoimmune disorders had experienced a large stress before the diagnosis of any autoimmune disease. Alopecia areata, alopecia totalis, and alopecia universalis are autoimmune conditions that result in varying degrees of hair loss. Listening to my clients at the Hair Restoration Center over the last 15 years share their personal stories of dealing with hair loss, each detailed recount of their struggles, it broke my heart. I now use words of encouragement and affirmations to help others see their worth and embrace their unique self so they are no longer bound by a lack of confidence and self-esteem. In retrospect, if studies show that immune conditions can be the result of stress, then ACEs can be a source of that stress. So we may conclude that the relationship between ACEs and alopecia may explain the complex yet evident connection between psychological stress and physical health. It highlights the importance of addressing the psychological factors and stress management in the treatment and prevention of stress-related alopecia, which is something I am familiar with using in treatment. For people affected by ACEs, seeking therapy and support can be crucial steps in healing both emotionally and physically, which may help mitigate some of the stress-related contributors to hair loss. Colleagues and I have seen how reaching spiritual healing with building self-esteem, empowerment, and finding a supportive community and using affirmations may be a few of the steps in the healing process accompanied by healthy habits. For example, eating healthy, getting plenty of sleep, and exercising. I invite you to help people with alopecia and appearance-related struggles to practice self-care, use affirmations, and build a community. We have the power to eliminate social stigma and ultimately save lives. As we return to Tricholwood, as the seasons change and the forest face new challenges, the other trees began to see the strength and resilience of the alopecia trees. They realized that despite their outward appearance, these trees had deep roots and a unique perspective on life that had been shaped by their experiences. Slowly but surely, the alopecia trees started to embrace their baldness as a symbol of their inner strength and resilience. They found solace in each other's company, forming a supportive community where they could openly share their stories and heal together. Ultimately, the alopecia trees taught the rest of the forest that scars do not define a person's worth. Their journey of acceptance and self-love become a powerful allegory for overcoming adversity and finding beauty in imperfection. And so, in the forest of Tricholwood, the alopecia trees stood tall and proud. Their bare branches reached towards the sky, a testament to the enduring spirit of those who have faced adversity and emerged stronger for it. Thank you.